Epidemiology is the study of the distribution and determinants of health related states or events in a defined population and application of this study to control the health problem. For any type of study, ultimate objective is to reduce the prevalence and incidence of the disease to a great extent so that it is not considered as a public health problem. So, epidemiology is the study of the distribution and determinants of health related states and events and among a defined population or in a defined group of population and application of this study to control the health problem. Why I am asking the definition of epidemiology? Because in the definition of epidemiology, it is clearly stated that it is the study of the distribution and determinants. Determinants means what are the causative factors or what are the agents responsible for the causation of the disease. So, it is the distribution and determinants of health related states in a defined population and application of this study to control the health problem. Now, let us discuss about the epidemiological studies. Epidemiological studies are broadly, one is observational study, and another is experimental study. Observational study, again it is, one is analytical study, another is descriptive study. In the previous class, I have discussed in detail about descriptive study. Descriptive study means occurrence of the disease or health related states in relation to time, place and person. And you analyze your data in terms of frequency among various groups, and ultimately you will come to a hypothesis whether this disease is due to these important factors or some other unknown factors. And this hypothesis, which is formed after doing descriptive study, this hypothesis is tested by analytical study. Now, today I will discuss about the analytical study. Analytical study, one is ecological study, another is case control, another is cohort, another is cross-sectional study. In case of ecological study, we compare the various morbidities among Indians with other people residing in other country, and we analyze what are the reasons for so many discrepancy. That is ecological study. In case of cross-sectional study, suppose we are collecting data, demographic data, census or National Family Health Survey, which is done at an interval of 5 years. We collect various demographic data or the data of under 5 children, how many children are stunted, how many children are malnourished, how many children are overweight. So these data are collected at a certain point of time. In a year, during July or during August, during this period, we collect data and we do house to house visit, and there is no cross checking or there is no follow up of this group of patients. We collect data for the one time. So in cross-sectional study, advantage is that we collect data how many people are suffering or how many people are normal, and based on that we analyze why so many people are suffering, and we try to find out what are the reasons or what are the factors behind causation of so much of important diseases or so much of increased prevalence or increased incidence of diseases. Clear? So at one point of time we collect data. There may be some people who are healthy, there may be some people who are suffering from diseases, and we also collect various important factors which may or may not be related for the high incidence of disease. Clear? And based on that we try to derive a hypothesis whether these diseases are related due to these factors. Clear? Now, in analytical study, two important study, that is case control study and cohort study. Case control study and cohort study. With the help of descriptive study, we hypothesized that cigarette smoking, per day 20 cigarettes smoking for 20 years will give rise to lung cancer among 20% of people. So this hypothesis, which was formulated with the help of descriptive study, will be tested with the help of case control and cohort study. Clear? In case of case control study, we find out the cases. We try to find out the cases who are suffering from a particular disease. I am giving example of smoking is due to smoking may cause lung cancer. It is the most important hypothesis which was which study was carried out by Doll and Hill, and it has been scientifically proved that cigarettes smoking may lead to lung cancer. So here cases will be, suppose persons who are suffering from lung cancer, and how will you define that this person is suffering from lung cancer? There may be malignant cells in the sputum, or there may be important radiological findings in favor of lung cancer, and we will exclude the advanced lung cancer cases, or we will exclude the old lung cancer cases. So only newly diagnosed, not advanced lung cancer cases will be included for my study. So one is eligibility criteria What is your eligibility criteria? That means only the new lung cancer cases will be included for my study and will exclude the advanced cases. And another is definition of lung cancer during my study period. হ্যাঁ আমি একটু পরে কথা বলছি, হ্যাঁ ক্লাসে আছি শুভদীপ। হ্যাঁ 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 আমি 1 ঘন্টা, হ্যাঁ পেয়েছি, আমি 1 ঘন্টা বাদে রিং ব্যাক করছি। তো during my study period I must strictly adhere to the case definition of lung cancer. Clear? তাহলে one is you strictly adhere to your definition of the case, and another is eligibility criteria for inclusion of the study. So first of all, your selection of cases. So in this way you will select cases. Now you have to select control. Selection of control. What should be the number of control? Suppose if the number of cases is 100, your control group will be double or triple. So control group will be double that of cases, or it may be triple, or it may be 4 times. But how the control will be chosen? Control will be chosen among the population in such a way that control group have same characteristics as that of the cases, except the risk factor which is under study. Clear? Suppose in a hospital setting you have chosen lung cancer cases excluding advanced case or excluding the old cases, so you have chosen lung cancer cases. But how will you choose the control? Control will be chosen from the same hospital setting, the same age group, same sex, same social condition. So from another department who are not suffering from lung cancer, suppose patients were admitted due to some eye problem, cataract problem, so you can choose those patients from another department, but they are not suffering from lung cancer. Clear? So selection of cases. Next is selection of controls. Why? If we do not choose the controls keeping in mind the similar characteristics among the two groups, your study result will be erroneous. That's why you have to choose the control from the same group of people in the same place, in the same setting, except the risk factor which is under study. Next is matching. Matching means case group and control group will match with almost all aspects. They will match. Suppose in case group, if the age group is 20 to 30 years, or if the case in the case group, if the age is 50 to 60 years, and in the control group, if the age is 20 to 30 years, your result will be erroneous. So there will be matching among various groups. That is group matching. Another is paired matching. If you want to do a study among the twins, then twins are almost identical in all respect, except the factors which you want to find out whether it is related with the disease or not. So one is group matching, another is pair matching. So you have to match accordingly, otherwise you will not get the true picture. Clear? After that you will do analysis of data. Analysis of data. You have to frame 2 by 2 contingency table. Risk factor present, risk factor absent. Cases, these are the cases, these are the controls. Suppose your total cases is 50. Total cases is 50 and control 3 times 150. Out of this 50, history of smoking is present among the 40 and no history of smoking among 10. Here, out of 150, say history of smoking among the 60 persons, out of 150, 60 people are smokers and 90 people are non-smoker. So this cell A, this cell B, this cell C, this cell D. It is C plus A plus C. It is B plus D. So frequency of exposure to the risk among the cases and frequency of exposure among the controls. You have to calculate the frequency of exposure among the cases. What is the frequency of exposure among the cases? 40. 50 into 100, 80%. It is expressed in percentage form. Clear? Frequency of exposure মানে ফর্মুলাটা যদি লেখো A by A plus C into 100. এটা হচ্ছে frequency among the exposed group, among the cases. Frequency among the cases. These are the case group, total 50. What is the frequency of exposure? Frequency of exposure means risk of smoking A by A plus C, 40 by A plus C means 50 into 100, so 80%. So in the among the cases, frequency of exposure is 80%, and among the controls, it is B by B plus D. That means B মানে কত? 60 by B plus D. 150 into 100. %। দেখো ক্যালকুলেশন ঠিক আছে, 60 by 150 into 100. So this it is the among the controls. আর কেসে কত ছিল? কেসে ছিল 80%। So frequency among the cases, frequency of exposure among the cases is much more in comparison to control, and this difference is tested, and here p value is less than 0.05. That means this difference is not a chance factor, it is not a chance factor. This difference is statistically significant. If you apply the chi-square test, you will find the p-value is less than 0.05, which is statistically significant. So this difference is statistically significant. Another is, what is the strength of association? That means you have proved the hypothesis that lung cancer is due to smoking for prolonged period, and this was tested. Here you find that there is association between smoking and occurrence of lung cancer. Now, what is the strength of association? AD by BC, cross product. AD by BC. What is AD? AD, that means 40 into 90, BC 60 into 10, এটা কত হলো 6। তো AD by BC ক্যালকুলেট করলে দেখবে it comes to 6. What does it mean? It indicates that smokers are 6 times more prone to develop lung cancer in comparison to non-smoker. Clear? Strength of the association means there is, as the strength of the association is 6, that means there is strong correlation between smoking and lung cancer. What is correlation? Or what is association? What is association? Association means occurrence of two variables more often than would be expected by chance. That means smoking এর সঙ্গে lung cancer একটা রিলেশন যে আছে, এটা হঠাৎ করে একটা সাডেন চান্স ফ্যাক্টর হয়নি। There is definitive proof that smoking for prolonged period may lead to development of lung cancer. In various studies, it has been proved that there is correlation between smoking and occurrence of lung cancer. So, in cross-sectional study, after analysis, we will find out whether frequency among the cases is more in comparison to control group, and whether this difference is statistically significant or not. Next is, if association is present, then what is the strength of association? For knowing the strength of association in case control study, we have to calculate the odds ratio. We have to calculate the odds ratio. AD by BC, it is the odds ratio. Odds ratio. Odds ratio mean odds of occurrence of disease among cases in comparison to odds of occurrence of disease among the control. Odds means chance. Chance of occurrence of disease among the cases in relation to chance of occurrence of disease among the controls. That is the odds ratio. Here odds ratio is 6. Clear? So, by doing this case control study, we will be able to test the hypothesis which was formulated by doing descriptive study. What are the advantages of case control study? So, after analysis, you find out whether the association exists between the exposure and occurrence of the disease, and if there is an association, what is the strength of the association. Now, case control study is very easy to perform, and it is not so expensive, and this case control study is done for rare diseases, and it takes less time to prove or disprove the hypothesis which has already been established. But another analytical study, there is cohort study. In case control study, after selection of cases and controls, we take detailed history. So we go back. That's why it is a retrospective study. Another name of case control study is a retrospective study, because we take the history of smoking, last 20 years or last 30 years, how many people are smoking, how many cigarettes are smoking per day. So, it is a retrospective study. Or cohort study, it is a prospective study usually. Cohort study, it is a prospective study or forward looking study. What is cohort? আগের দিন বলেছিলাম. What is cohort? Cohort is a group of people having a similar characteristics. Cohort is a group of people having a similar characteristics. Suppose if I want to do a study among doctors, among students, or among nursing staff, so these are the various cohorts: student group, nursing student group, doctors group. But if I mix the doctors and the medical students, these two groups are not homogeneous group. So cohorts means a group of people having similar characteristics. So in case of cohort study, first of all, we have to select the cohort from the general population, or we can select cohort from hospital settings or from students. So in cohort study, we can choose mothers who are attending at antenatal or postnatal clinic. So all mothers who are attending antenatal clinic or mothers who are attending an immunization clinic. From the mothers, you can choose your cohort group. So in the cohort group, there will be two groups. One is study cohort, another is control cohort. Suppose you want to do a study regarding feeding practice of infants and their morbidity pattern of the infants. Feeding practice and morbidity pattern of infants. You want to do this type of study. So first of all, you have to take the history of feeding. Whether, suppose your study groups includes 6 months to 5 years, this age group. So you ask the mother whether your baby was fed on breast milk for first 6 months or not. If an infant is fed only with the breast milk for 6 months, that means the child is exclusively breastfed. Giving only breast milk for first 6 months after birth, that means the infant is exclusively breastfed. So your study cohort will be exclusively breastfed infant. Initially, you have recruited those infants above 6 months who are exclusively breastfed. So these are the study cohort. Your study cohort is exclusively breastfed infants. And another group among the infants who are not exclusively breastfed for 6 months are your control cohort. Not exclusively breastfed. So you have selected cohort. Among the cohort, 2 groups were identified based on history of giving only breast milk for first 6 months. So infants having history of giving exclusively breastfeeding will come to this study cohort group, and another group of infants who are not exclusively breastfed were included in the control cohort group. Next is you have to follow up these study cohort and control cohort. Again, no question of matching. No question of matching. Because cohort means the group of people having similar characteristics, all are in the age group of 6 months to 5 years. So all children have almost similar characteristics, except one group gave history of exclusive breastfeeding and another group didn't breastfeed exclusively for first 6 months. So your study was to find out any relation between exclusive breastfeeding and morbidity pattern. Exclusive breastfeeding and morbidity pattern. So you want to test the hypothesis that exclusively breastfed children are suffering less in comparison to infants who are not exclusively breastfed. In another word, artificially fed or not exclusively breastfed infants are more prone to develop various morbidities. It may be ARI, it may be diarrhea, or it may be malnutrition. So, these various morbidities, frequency of various morbidities are more among the non-exclusive breastfed infants. On the other hand, exclusive breastfed infants are less prone to develop ARI, diarrhea, malnutrition or other morbidities. Clear? So, you have to follow up. কতদিন বাদে বাদে follow up করবে? You can do follow up at an interval of 2 weeks. According to your feasibility, you can follow up these 2 groups of cohorts at an interval of 2 weeks or at an interval of 4 weeks. So, when mother will visit again at immunization clinic in the next month, you can do it as according to your convenience after 1 month. So, in the immunization clinic, mothers usually come at an interval of 1 month. So, after 1 month, you will ask the mother whether your child is suffering from ARI or diarrhea in the last 15 days, whether your child suffered from any major illness. If yes, what type of illness, and you write down how many of infants suffered from illness. So, among both the study cohort and control cohort, you will do follow up at an interval of 1 month, and you continue this follow up up to say 1 year or up to 6 months. According to your feasibility, you can do follow up either 1 year or 6 months, or it may be even more than that, 2 years, 3 years, 5 years. So, you do regular follow up, and after that you will do analysis of data. Analysis of data. Here we can calculate the incidence rate, as we have denominator population, so we can calculate the incidence rate. Here we calculate the risk ratio. What is risk ratio? Incidence of disease among study cohort and incidence of disease among control cohort. Clear? Incidence of disease is 66%. That means 66% lung cancer cases are attributable to smoking. That means 66% lung cancer cases are due to smoking. In other words, if we can eliminate smoking among the people, will be able to eliminate 66% lung cancer cases. Lung cancer is due to the smoking. This example you can apply in case of case control study. You can also apply in case of cohort study. One important cohort study which was done in the year 1954, and this study continued even after 2003. So 3 generations were included. That is the Framingham Heart Study. Framingham Heart Study, they recruited 5,209 people. All were healthy, and the study cohort group were in the age group of 32 to 62 years. 32 to 60 years, all healthy people were included in this study, and they were followed up for 30 years or more than that. In the year after 1954, in the year 1971, again another second generation group of people were included for this study. Again in the year 2002 and 2003, their grandchildren were recruited for this study. And one interesting thing is that in the year 1960, it was found that coronary heart disease or cardiovascular disease is more among those who are obese, who are hypertensive, who are smokers, and who have more cholesterol level, high cholesterol level. So smokers, obesity, having high cholesterol, having hypertension are more prone to develop various cardiovascular diseases. In the year, from this study, these are the important findings. In the year 1970, it was found that people having hypertension for prolonged period are more prone to develop myocardial infarction, that means heart attack. So people who are having hypertension and not under medication are more prone to develop myocardial infarction. In the year 1980, from this study, it was found that HDL cholesterol, you have read biochemistry, HDL means high density lipoprotein. HDL cholesterol is protective to the heart. Jodi amar HDL cholesterol more than 50-60 thake, there is less chance of developing cardiovascular disease. So from this Framingham Heart Study, these important conclusions were drawn by the investigator. Another important finding is in the year 1990 that left ventricular hypertrophy may lead to heart failure. And later it was also scientifically proved that the people whose left ventricle is large enough are more prone to develop myocardial infarction or heart failure. Clear? Now in the year 2000, it was found out that people who are normotensive but in the higher range of normal hypertension, they are not hypertensive but in the higher range of hypertension, they are also more prone to develop cardiovascular diseases. So these important findings were drawn based on this important cohort study. This study, Framingham study, is a 3-generation study. So based on this scientific study, we have concluded that these are the important risk factors, and if anyone does regular exercise, there is less chance of development of cardiovascular disease. So these important findings were found out by doing this research work. So this cohort study is very much important study. So there is no intervention in case of observational study, and also in case of analytical study, we are not doing any kind of intervention. But in experimental study, we do intervention. একটা গ্রুপকে আমরা একটা পার্টিকুলার নিউয়ার molecular drug দিলাম which is more effective against diabetes. Another group তাকে একটা placebo দিলাম, and these group of people were followed up for years after years, and after that will compare how many of people are suffering less and how many of people are suffering more. So by doing frequency among these two groups, we came to a conclusion that yes, this newer molecule is more effective to control diabetes. Clear? So here we are doing intervention by giving some drugs, or we can do some newer technology. এখন ল্যাব কলি করা হচ্ছে না, আগে করা হতো কি ওপেন ল্যাবরেটরি। সো উই ক্যান কম্পেয়ার whether laboratory is more economical, more beneficial in comparison to open laboratory. So by doing repeated follow-up, we can conclude that yes, this newer technology is more beneficial to the patient, and after that we will apply that technology. Clear? So these are the experimental study. But in case of case control, cohort, cross-sectional, observational, we are not doing any type of intervention. We are just taking the help of questionnaire. We have prepared the questionnaire and we have tested the questionnaire with the help of that questionnaire, or by sending email. We are collecting data, and after collecting data, we are analyzing this data, and based on your findings, you come to a conclusion that yes, these results are due to these risk factors. And with the help of analytical study, you will establish whether the hypothesis holds good or whether you will reject the hypothesis. Clear? So analytical study and observational study, here we are not doing any type of intervention. But in case of experimental study, we do intervention, we do regular follow-up, and after that we compare the two groups and we see whether this newer technology is more helpful to the patient, or whether this newer molecule is more rational in relation to the old regime which are being given to the patient for years after years. Clear? এই যে ফার্মাতে আগে একটা ওষুধ দেওয়া হতো, এখন দেওয়া হচ্ছে না, থ্যালিডোমাইড। দ্য সেকেন্ড ওয়ারে থ্যালিডোমাইড প্রচুর প্রেগনেন্ট ওমেনকে দেওয়া হয়েছিল, তারপরে দেখা গেল মেনি নিউবর্ন সাফার্ড ফ্রম লস অফ লিম্ব। তার একটা লিম্ব ডেভেলপমেন্টই হয়নি, তখন দেখা গেল ইয়েস, থ্যালিডোমাইড, দিস ড্রাগ ইজ রেসপন্সিবল ফর congenital deformity, and after that thalidomide was banned. সুতরাং একটা ওষুধ তুমি বছরের পর বছর দিয়ে যাবে, কোনো মরবিডিটি হবে না, এটা ভেবে নেওয়া ঠিক নয়। যার জন্য রেগুলার বিভিন্ন রকম সায়েন্টিফিক টেস্ট হচ্ছে, বিভিন্ন রকম তোমার রিসার্চ ওয়ার্ক হচ্ছে। যদি দেখা যায় রিসার্চ ওয়ার্কে বেটার মলিকুল পাচ্ছি, তখন আগের মলিকুলগুলো বাদ দিয়ে আবার নিয়ার মলিকুল আমরা নেব। ক্লিয়ার? এই যে এপিডেমিওলজিক্যাল স্টাডি, এটা তোমরা নিজের একটু পড়বে। ইফ ইউ ফেস এনি ডিফিকাল্টি, you may come to my department and you may ask any sort of questions to our faculties. I think all of our faculties are with you to help you.